The year is 2019. Today I'm going to tell you a story from the year 2019 until today. This is Ekima Hub. My name is Mary Kadhomi Ryongo. And on this podcast, we're going to be having conversations. We're going to be having stories. We are going to tell stories about ourselves. We're going to tell stories about our communities, stories about our lives, stories that are going to educate, enrich, and make us a better people. We're not going to gaslight, we're not going to judge anyone. So feel free, do not feel like you cannot talk about these things. Let's talk. And today, we're going to start with the story of coronavirus and COVID vaccine. I'm not going to use the word vaccine a lot. I'm going to use the word shots. So when I say shots, please understand what I mean. The year is 2019 again. And in Wuhan, China, we have an outbreak of a virus so deadly that countries had to lock down, so deadly that we had to stop working from our offices. We had to start working from home. Every single country had to get measures of survival. Not just countries, even us as a people, we had to get ways of survival. Do you remember that in China, on the news, them showing so many people dying, like they died in their thousands, such that the Chinese authorities could actually not even bury their people. There were so many in the hospitals, the dead people. There were so many in the morgues, such that they couldn't bury. Actually, they had to cremate. The question is, was that a true story, or was that a media story to create a perception? Let's talk about it. There was so much fear. Every country was not allowing flights in and out of the country. I'm going to give this story on the perspective of a Kenyan because I'm a Kenyan. And when all these things were happening, I was in Kenya. This story is not very different from a person in the US or another person, say, in Britain or Europe or another part of Asia or even other parts of Africa. We were all affected by the coronavirus pandemic, more so in the same way. And so here in Kenya, flights were not allowed. And if you had to fly in the country, they had to put you up in hotels. They had to test you. They were testing all over. They had to insert the testers in your nostrils. It was a whole survival mechanism. And in Kenya, we had a patient we called patient 00. This was a student. I remember her name was Ivy Brenda. She was a student who was flying into the country. She was the first student to come into the country with coronavirus. And that's where I realized something was not making sense. She flew in at the Jomo Kenyatta International Airport, took a taxi, went into her home. I can't remember if it was a home or her boyfriend's place. But she did not infect anyone, but she was the patient 00. And out of a lot of things that are not adding up, I started putting myself in a research mode.
How has been your journey from the United States coming into the country to the point when you knew that you have some symptoms and you sought help from the government?
When I first took the flight from Nairobi to the US, there was only a few cases of the virus, but then that time it was only in China, I think. It hadn't really gone outside the country. So that time, I took the plane to the US, and then I stayed there for about 2.5 months. Then when I took the flight back to Nairobi, that time now I think it had gotten to some parts of Europe, and there were a few cases in the US. So I wasn't so scared about it. I wasn't so nervous, but I had surgical masks with me, and I had everything, the sanitizers. So when I got on the airport, I was the only one actually in the airport in Cleveland with the masks on, and everyone was looking at me thinking I'm crazy. So when I landed in London, that's when now I became a bit worried, because then we were using so many trays. So many people were using so many trays. The security was touching everyone's stuff. But and I still had the sanitizers and the masks on. But That's when we went through the security and we took off our masks, and then we got into the plane, and then that's when we came to Nairobi. So I think I may have contracted it either in London or on the plane back to Nairobi.
Were you worried about the people you're interacting with at home?
I was very worried because I'd interacted with people in the house. So that was a concern for me, and we talked about it with the people I was living with. I told them there's a chance that this can be the virus, and if it comes that way, I would like all of you to just come out and also tell the ministry that you had been in contact with me. We had that talk with them before I went to the hospital.
So second day, you're still coughing. Then what did you do?
On the second day, there was no cough. The cough had gone away completely. There was just a small headache, and then it went away. So by the time I was presenting myself to the hospital, I didn't have any symptoms. It was just, I told them I was having a cough yesterday, and it was, the cough was a little too consistent. It was coming too many times in 1 hour.
Who did you call?
I called Mbagathi Hospital, and then I also called the toll-free number. Yeah.
So they picked you from the house, or you drove yourself there?
The toll-free number wasn't, I don't know, I think it was busy that time, and the numbers from Mbagathi Hospital were also busy. So that's when now I decided to take a ride to Mbagathi Hospital, and they were very, very helpful when I got there. They were very concerned, and they took me seriously, because if they hadn't taken me seriously, I probably would have also just gone back to the house.
So the process when you reported and they treated you nicely, like you've just said, what was the process like for you, and up to the point when now they told you you're positive? And did they tell you, or did they put it in writing? How did they disclose this to you?
When I got to Mbagathi, I asked for the isolation center, because I'd read on the news, I think there was an article about there being an isolation center in Mbagathi Hospital back when I was in the US. So when I got here, the first thing I asked my friends, do you know any isolation center? And then we Googled, we got the toll-free number, and we got the information. So when I went to Mbagathi, I asked them, where is the isolation center? And then they pointed me in that direction. So I went there and presented myself. And the nurse there called the Kenyatta National Hospital. And then Kenyatta came for me. And then that's when I got to Kenyatta, and I got the test done the next day.
So the test came out positive after how many days when you were there at Kenyatta?
I think, I'm not too sure, but I think I may have spent 2 days in Kenyatta. It was 1 day. Yeah, it was 1 day. Then the tests were taken, and the test came back after 1 day. Yeah.
How did they break the news to you?
I didn't get the news. I got it from the media when it was announced.
I started researching the story of this pandemic. Patient 00 came, she was all over the media, and of course a lot of fear was inflicted in the people. I hope you remember our Minister of Health had to constantly make an announcement every evening about the number of people that have been infected and about the number of people that have died. It was so much mental torture. Personally, I couldn't watch TV.
We have managed to discharge about 1,100 people from our follow-up program on the expiry of 14 days. Currently, we are also monitoring some 672 people in our follow-up program.
Every single day, being reminded about the number of people that have been infected with coronavirus. Take that and put it somewhere. We are going to refer to that information as we keep talking about this story. And out of the fear, of course, out of trying to save my life and saving the lives of my family, what did I do? I was the very first people to purchase N93 masks. Of course, the story was we needed to sanitize, we needed to clean our hands, we needed to put on masks. We were not supposed to shake our hands. You know what? You needed to save the people that you love. You needed to reduce the chances of infecting from one person to the other. And I did this to the letter as Kathomi. I didn't want to kill my family. I had to protect my family. But this story was not making sense. I work in Nairobi, the Central Business District. And at the Central Business District, there are a lot of street families. And one of the things that I observed, all the street families still slept on the streets. They were abandoned on corridors along the streets, the mother, the father, the children. And every time I walked on those places, I was concerned. These people are not dying. I thought we were told that there's a pandemic and everyone is dying. But according to what my eyes could see, the street families were actually not dying. Anyway, this started raising a lot of antennae in my brain. I use public transport. I would take what we call in Kenya matatu. This is public transport from home, and I would go to the CBD. And of course, as you're taking the public transport, you even don't want to touch anyone. You don't want body contact to reduce your chances of infection. You also don't want to greet anyone. We were not even holding the doors or holding anything, because then the story was the viruses were all over. So you would get, those funny ways of getting into the public transport, and go to town and do my business. Of course, there were less and less people. I am a business person. Another thing that I observed that raised my antennae was the way Kenyans were disposing of the masks. Kenyans were throwing the masks all over.
The government is raising alarm over the disposal of masks in different towns. The Water and Sanitation Department says residents have been discarding used masks in the street.
Natumianga mask after 2 hours na dispose tu penye mimi naenda nayangusha tu.
Sana ukienda huko kwa ziwa hako wengi, pale stage hako wengi, ukitembea kando ya barabara watu wanatupea tu hizi mask.
If something is not done, we will have a new pandemic. We will have a new virus that may have been hardened even more than the coronavirus.
Watu hawaogopi juu wanaona tu ni kitu kawaida. Kwa kusema kweli, watu hawajakuwa na uhakika eti hii virusi ya corona inaweza fanya kitu gani. Hadi wanaona tu ni kitu kama kawaida, hawajaona eti ni kitu ya maana sana ama ni kitu yenye inaweza umisa jamii. Yani wanachukua tu kama kitu kawaida tu.
And I ask myself, if this is the way masks are being disposed, how comes we do not have a genocide? How comes people are not dying in their hundreds? That was another antenna that was raised in my brain. There's something that was not making sense about this pandemic. Okay, too many, loopholes in this story, but you know what? Let's just go on with the government narrative. Maybe they know better. And I was a big social media influencer on Facebook since 2018. I did a lot of political influencing on Facebook. And I used my social media to help people, to inform people. And I used to do videos about how to treat coronavirus at home. Get a video about, mixing ginger, lemon, and honey, boiling, those home herbal remedies and taking that would heal coronavirus. And you know what? That simple home remedy on social media was marked as violating community guidelines. That was another red flag. So I kept asking myself, how do we censor such information? Another antenna was pricked in my head, and I started a research in 2020. Of course, we had a lot of time since we didn't go to work as much, and I went into a research trying to understand what exactly was this issue around coronavirus. And as I do these things, of course, the minister, the WHO is giving guidelines, how do we need to deal with this virus? What do we do? Every now and then, they were guiding the public, they were guiding the people on what to do. Clean your hands, put on a mask. Did they talk about a meter away from another person? Don't greet people. They were giving guidelines day in, day out. Guidelines. Our Minister of Health was always announcing, numbers are going up. Those numbers never went down. A lot of things were not making sense. And as all these things happened, I watched, and in process of my research, I watched Event 21. Event 21 was an assimilation exercise of how the globe, how the people, how governments, how ministers of health, how hospitals are going to react in case the globe was faced with a pandemic. After watching Event 21, I realized this was not just a pandemic, this was a plandemic. Everything was planned to the letter. Even what was going to happen, how were human beings going to react when you lock them up? When you tell people, do not kill your grandma, how are people going to react? And I realized I put 2 + 2 together, and I realized this was just not a virus. This was a pandemic. The year had gone a bit. Now we are in September of 2020, and out of survival, countries have started manufacturing their own medicine. I remember Madagascar manufactured its own medicine to treat the coronavirus. But what did the WHO do? The WHO marked the Madagascar medicine as not approved by the WHO. In the neighborhood, we had Uganda. Uganda also were manufacturing their own medicine. They were using the malaria way of treating, but a particular dose, the chlorophyll. WHO again flagged the Ugandan medicine. Then I realized this was a script. This was a pandemic. When you go to the countries of West Africa, Senegal, Nigeria, countries around that part of Africa had already come up with a treatment method of the coronavirus. What was their treatment? A particular dose of chlorophyll. That's malaria medicine. It was actually treating coronavirus. But still, the WHO marked it as not approved. When I put a lot of things together, I went deep down to the rabbit hole and I realized this was not a pandemic, this was a pandemic. And as I kept moving on and on and on, the way the whole thing was controlled, then I realized the end game of coronavirus was the shots. The entire humanity was being driven towards the shots. And remember, people needed to travel, people needed to move around, some people needed to work, and there was a blanket requirement worldwide for you to travel. You needed to do what? You needed to get the shot. And of course, those shots were not there yet, but mentally, people were prepared. People were prepared on getting the shots. I forgot to mention, the WHO had also given how coronavirus patients were supposed to be treated. So there was actually approved treatment methods. Since when did we have a disease that was this controlled? And which kind of method did they approve? Treatment by ventilation. So when you went to the hospital with coronavirus and you had problems with breathing, the hospitals were mandated to use ventilators to treat you. They were not going to use the chlorophyll that was working. They were not going to use the Madagascar medicine that was working. They were not going to use the herbal medication that was working. They were going to use a prescribed form of medication. And more and more and more, it became clear that this was a plan. What did the ventilators do to the patients?
Critical care doctors say many patients placed on these machines don't survive.
The outcome for a patient who has to be ventilated is horrific.
Chinese researchers studying critically ill patients on ventilators in Wuhan found in a group of 32, only one person survived. Another study from Wuhan suggests about 20% of patients on ventilators recover. Once connected, the ventilator often blows in 100% oxygen. The average room air is 21%. After several days on a ventilator, high levels of oxygen can become toxic, damage the lungs, and lead to other serious complications.
So many patients that went to hospital actually died out of the treatment that was used to treat the coronavirus. Let's talk about how patients that went to hospitals were put in rooms alone, no family allowed, no human interaction. What exactly happens to a human being when you limit human to human interaction? People get depressed. That's why people are put in prisons. Because a human being is built to socialize, to connect with another human being. So when you got infected with coronavirus, you are put in a hospital and you had no human interaction. And in most instances, that lack of human interaction killed more people, especially the old. You had to go and see your grandmother, your mother, your sister. You had to watch them through a window. You couldn't even shake your hands with your family members. That in itself was an approved way of treating coronavirus patients, but it killed more people than actually helping the people. And when you look at these things, it more fits into the script of a pandemic. As we continue talking about these things, year 2020 has come, it's gone, and now we are in year 2021. And now vaccine companies have come. We had the Moderna, we had the AstraZeneca, we had the Pfizer, we had the other one of Russia, and all these companies were now manufacturing vaccines. And before I talk about the vaccines, humanity was already so desperate to survive. Everyone wanted to live. And so many people, according to the media, had already died. And people wanted to save a few people here and there. So what did they do? They started rolling into the vaccines. And it was already out of the controlled media coverage, it's already ingrained in the human race that for you to live, you needed to take the vaccine. For you to heal the coronavirus, you needed to take the shots. So humanity was eagerly waiting for the shots and lining all over. But something that I noticed is that these shots, these companies that are manufacturing the shots, had actually branded particular shots for the African continent. So there were vaccines that could not be used in Europe or in the US, but were only allowed to be used in Africa. That was another red flag. Why Africa? Why a particular shots for the African people? And when I talk about my country, and when these shots were rolling into the country, what happened? The government officials were in a frenzy of looting. In Kenya, we have the infamous COVID billionaires. All the money that was coming, the donations, there are a lot of donations to governments that are complying. There was a lot of money for masks, a lot of money for sanitizers, and of course, budgets, for providing the shots themselves. The Kenyan government officials looted in a big way. And that was another red flag. If people were dying the way the media was portraying or making it look that people were dying, why was our government looting money? They were not keen on saving the population? That's another question that we need to discuss. And as we continue looking at all these things, then you realize that the coronavirus in itself had an endgame. We have a lot of science papers that have been presented, and the time frame proven for a vaccine, the testing, the human trials, there is no shots that come to the human race within a period of less than 5 years. But we are here in 2020, towards the end of 2020, already the shots were now being given, to the populations. So how quick were these vaccines manufactured? That's a question we need to ask ourselves. And according to my own research, these shots were already manufactured and stored, ready to be released to the human race. Were they really vaccines, or what were they? And a lot of things happened, and it was evident that the WHO had already approved the Pfizer, the AstraZeneca, the Moderna. They were already approved by the WHO. Evidently, with a lot of noise from even scientists, that these vaccines had not gone through the required tests. They had not even done the human testing period. But the WHO allowed, and it was rolled into the public. And after the vaccines were rolled into the public, and of course the panic to leave, so everyone wanted the shots. Everyone wanted the shots. Everyone was lining. What I did on my social media, I warned people, do not rush. Do not rush to take these shots. Don't rush to take these shots. Take your time. And of course, in the documents that were released by the WHO, the coronavirus was supposed to mutate. It was going to be mutating from one form of a virus to the other. They say when a virus is exposed to humanity, it mutates. So the story was we needed to keep taking, you take the first shot, you take the second shot, you take the third shot, you keep taking many shots. Why? Because this virus was going to keep mutating. But something funny happened. Even the very first group of people that took the shots still got coronavirus infections. A few months down the line, it was already proven that even with the shots, you would still get an infection. So every other time, the WHO briefings, they were always camping to explain, to keep explaining things that are not making sense. So much was already not making sense at that point, So there was the stories that they are going to keep upgrading these shots. To keep up, to keep up with the viruses that are mutating. Not many Africans took the shots, but we have a couple of millions of Africans that took the shots. I personally have friends that took the shots. Of course, I tried my level best to tell them, don't do it. Take your time. Don't be the first one. First watch and see what exactly is happening. But, the brainwash from the media, the control from the WHO, the government-controlled narrative was already so sunk into the populations, everyone was running to take it. I personally have friends that took it. I have family members that took it. Not even 6 months down the line, the adverse effects were felt. I have friends, female friends, many of them, we went to the gym together, we have a lot of social gatherings together, told me that since I took this shot, I bleed for more than 2 weeks. My menstruation has changed. I bleed until I get anemic. Something about me changed. Even in the Kenyan media, a few months down the line, there was news on NTV about the explosion of cancer cases in Mombasa.
The spiraling cases of cancer recorded across the 6 coastal counties is now gaining the attention of the medical officers at the Coast General Teaching and Referral Hospital, a regional cancer center in Mombasa. This year alone, 1,827 people have been diagnosed with the cancer of the breast, 1,338 with the cervical cancer, and 1,045 residents also found with esophagus cancer. 654 cases of prostate cancer and 464 lymphoma cancer have also been recorded at the facility.
But still, no one can really connect what exactly was going on. I have a lot of people that are suffering from side effects. Let me call them adverse side effects. How many people, after taking the shots, today suffer from backbone problems, collapsed discs on the back, nerve problems, people that can't walk, excessive pains? How many people suffer from abnormal migraines, headaches that literally almost killing?
The CDC says there could be a safety issue with Pfizer's updated COVID-19 vaccine. New numbers reveal a possible increase in a certain type of stroke in people 65 and older who recently received one of the updated boosters. This potential risk was detected using a monitoring system that called the vaccine safety data link. Seniors might be more likely to have these kinds of strokes within the first 3 weeks after the shot compared with weeks 4 through 6.
How many people have died in our hospitals since then from blood clots? Excessive cases of blood clots from people I know, from reports. Blood clots in the brain, blood clots in the legs. Blood clots have been killing people. There are even science papers from doctors, after postmortems have been done on bodies. Many more cases of people dying of blood clots have been reported since 2020. And of course, the story and the narrative is going to be, not everyone has been affected. Not everyone is suffering from the adverse side effects. Don't forget, when you are being given the shots, you are given a batch number. So these shots had batch numbers that were even, put in the MOH, the Ministry of Health website. Your shot had a batch number. Your batch had a code. Who was going to release poison to the public with an entire sample of a poison? Of course, to me, some of these shots were saline water or something not really affecting the people. But there are other samples, other batch numbers that were actually not the shots or the vaccines as they call them. It's now proven even in the court of law what AstraZeneca and Pfizer were administering to the populations was actually mRNA agents. It was actually not a vaccine. It was an mRNA agent. And in my next episode, I'm going to bring in a medical doctor and we are going to have these discussions about the effects on the people. What are the side effects? What does an mRNA agent do to a human body?
When the vaccines were being rolled out, some scientists who knew what mRNAs were designed to do warned that they could possibly change our DNA. Now, obviously, this set off a frenzy amongst people who were already vaccine hesitant, and anyone who cited this as a concern was then labeled a conspiracy theorist. So that is where this claim came from, and apparently a study by some Swedish scientists, which we'll get into, was trending on social media to the point AP and Reuters decided to issue some fact checks. So here's AP's fact check. Social media users are citing months-old study from Sweden to push the unproven theory that mRNA COVID-19 vaccines permanently alter recipients' DNA. Experts and the study authors say the research is being misinterpreted. Here are the facts. I want to just so you know, hone in on that word permanently. So they are kind of giving some they're qualifying it a bit. But let's see what the AP's fact check article says. So in the article, it says, claim a Swedish study shows that Pfizer's COVID-19 vaccine changes recipients' DNA. AP's assessment, false. The study tested whether the vaccine's mRNA could be converted to DNA and found that this was the case in certain lab-altered liver cell lines under experimental conditions. It did not assess whether the vaccine alters the human genome or what the effects of that would be, according to experts and the study authors. Experts say additional research is needed because the findings in the lab setting cannot be used to make inferences about what might happen in a human body. So I found this statement interesting for a couple of reasons. First of all, I noticed AP didn't call this a conspiracy theory, but instead an unproven theory. So this gives me a little hope that maybe the trend of labeling anyone who questions something as a conspiracy theorist, maybe that's waning. Secondly, rather than just dismiss the claim outright, they did state that experts say more research is needed. So it's inconclusive. Now let's look at the Reuters fact check. A Swedish study conducted by Lund University does not show that mRNA COVID-19 vaccines permanently alter human DNA. The authors said their study could not be used to draw conclusions with human DNA as they used cell lines in lab petri dish for their work. Now, Reuters actually links us to a Q&A with the study's authors on the Lund University website, and the authors say the reason why they even took up this study was because of a previous study published by MIT, which indicated that SARS-CoV-2 virus mRNA can be converted to DNA and integrated into the human genome. Now, that study set off a frenzy and received an enormous amount of backlash for, quote unquote, feeding the vaccine skeptics. But the Swedes wanted to further study this, and what they did was they took human liver cells, to see if the mRNA would penetrate the nucleus and integrate with the DNA, and they found that it did. They said, quote, "We show that the vaccine enters liver cells as early as 6 hours after the vaccine has been administered. We saw that there was DNA converted from the vaccine's mRNA in the host cells we studied. These findings were observed in Petri dishes under experimental conditions, but we do not yet know if the converted DNA is integrated into the cell's DNA in the genome, and if so, if it has any consequences." So the reason they chose liver cells was because during testing, a Pfizer study injected the vaccine into mice and found that 18% of the vaccine accumulated in the liver after 30 minutes. So these researchers decided to try it on human liver cells. And they went on to say, quote, "It's important to bear in mind that the liver cells in the study are more genetically unstable than our own liver cells." So they give you that qualification of this whole entire study. So we don't really know what it would do in a living organism, a human being, and to our liver cells, but they saw what they saw in the Petri dish. And they said, quote, "We understand that the study would attract attention, but we think it's self-evident that this type of research should be pursued. We have a new vaccine, and it needs to be tested in cell and animal models and also in humans in various ways. The results might be surprising, but it's also a bit surprising that such studies do not seem to have been carried out before." So that was the whole fact check that was going on social media with AP and Reuters. I thought it was really interesting, the framing of it, how they didn't conclusively say it does not. Now, when experts first came out and said, there's a possibility that it does this, and then people were saying, oh, I don't want to take something that's going to change my DNA. There was an enormous amount of fact-checking that came out from various media organizations, health organizations that said, no, it does not do this. And they stated that conclusively. And then MIT came out with a study in December of 2020 and said, actually, kind of looks like it might. And now this Swedish study from Lund University says, yeah, maybe, and more needs to be done to be studied on this. And now you've got AP and Reuters saying, okay, inconclusive. I mean, that's what their fact check basically came back as. Rather than say, it doesn't, you conspiracy theorist, you, they actually said, inconclusive, more study is needed.
Some people are okay, but a good number of people are not okay. We have high levels of infertility since 2020. People that would easily, normally conceive, nowadays do not conceive. Talk even to gynecologists. One of the biggest problems that Kenyans are suffering is infertility, low sperm count. Erectile dysfunction is now a pandemic in this country, though no one talks about it. People, young men, even in their 30s, that cannot perform sexually. We have an explosion of cancers. Right now, cancer in this country is actually a pandemic, for lack of a better word. Cervical cancers, breast cancers, colon cancers, all manner of cancers are now an explosion in this country. I'm not going to sit here and give it a direct link to the shots, but what explains that surge? What something different did we do as a population that has changed so much of our lives? We have serious problems around the things that personally I've had: heart problems, diabetes, blood pressures, hypertension, cancers, blood clots, erectile dysfunctions, so many problems that the population never used to deal with. As I conclude this conversation, we're going to have a part 2 and a part 3. I'm going to bring in people, we are going to have conversations with people that actually took these shots, but now they have suffered adverse effects, liver problems, kidney problems, serious problems that were never in the Kenyan population. But as from 2020, there's a lot of reporting of these things. As we speak today, in countries like US, in countries even in Britain, it's been proven in court that AstraZeneca was actually poisonous to the human population. There are people that have gone to court and have sued even for being sacked or terminated in their employments for being forced to take these vaccines as a mandate.
is what we call primary pulmonary vasculopathy, which is a fancy word for saying the issue is a primary issue of the vessels of the lungs, not necessarily the airways, which is what most people associate when they think about a pneumonia.
And I think a lot of people would be surprised to hear that the ventilator actually could have contributed to people dying. Is that right?
100%. Yeah, it was actually, if you think about the vessels, if you already have vessels that don't work very well, what's the worst thing you can do to them? Actually blow more air in them, increase the intrathoracic pressure, and actually close down more vessels and actually make the oxygenation worse.
Let's talk a little bit about, I know you've written a lot about the COVID vaccine. What are some of your big takeaways from what you've learned about it?
So the interesting thing was what we knew, and actually when we talk about coagulation and how things attack the vessels, was the spike protein was really what was causing that. The spike protein attaches to this thing called the ACE2 receptor that's present in the inside of your vessels, and that's why COVID is really a vascular disease. But it was interesting as we started to understand COVID and understand that the pathogen was the spike protein, that the solution that was offered was actually to tell people to make the spike protein for an unknown amount of time for an unknown amount. And that is actually where we got off. Meaning historically, when we think about vaccines, vaccines are passive, meaning your body interfaces with a foreign protein. But usually that protein is not something that's active biologically to most people. But instead to pick the very protein that is pathological and actually have people make it in a way that we didn't really even understand. Even the biodistribution studies are just now catching up, where the old "it stayed in your arm" is completely false. And we know that now. But of course, the studies just came out because really we weren't studying it before we basically told everybody it was safe and effective. So in a sense, it is what I would consider not even in the same classification as a typical vaccine. And it's kind of the redheaded stepchild of vaccines. It's almost the person you don't want in your family because it's going to ruin the reputation of all the others.
And is this all the vaccines or just?
Just the mRNA vaccine. Okay. And so the mRNA vaccine is.
But that was Pfizer, that
Pfizer
was
and Moderna. Yeah, and then I will say the Johnson & Johnson was an adenovector vaccine. So it used the capsid of a virus and had your body utilize the outside of a virus called the adenovirus to actually have your body be attacked and replicated. But it was in a very different way. We also had a lot of history with utilizing adenovector viruses to vaccinate. And so we had a lot more data on what was going on. The mRNA was a technology that isn't new. But even in 2018, the NIH itself said that this technology had lots of holdups. And actually, a lot of those holdups are the very adverse events and adverse effects that we're seeing, which is we didn't know where it went. We didn't know how it impacted things. We didn't know how long people were going to produce it. In a sense, think of the mRNA as almost like a blueprint that you're giving your cells to make the protein. And again, a protein that we knew was pathogenic. And the reality is we don't know how everybody reads those blueprints and how long they read those blueprints and how long they make the blueprint's effects. And that's a very different thing. That's called active. It's an active mechanism as opposed to a passive mechanism. A passive mechanism is you take a small amount of a protein or a other kind of live attenuated basically vaccine, and your body interfaces it. But we interface with a known amount of the protein. This is very different in a sense that we're actually making the body make something for an unknown amount of time, for an unknown amount. And then the other thing is the biodistribution studies, specifically recently in a paper in January of 2025, show that it actually targeted things like the ovaries, the heart, the liver, those kind of places. And again, that just shows you the lack of knowledge about the biodistribution when we thwarted this on the entire population with the mantra that it was safe and effective.
During the height of the pandemic, we were measuring deaths by the millions. Tens of thousands of people a week were dying. Are you advocating that the vaccine not be used? I mean, this is crediting with saving lives and for making this a global pandemic to something that we only talk about, once in a while.
Yeah, I think the vaccine itself is questionable on whether it saved lives looking at the data. Does that make sense? And so the other thing is what they knew about the technology is it would rapidly cause mutations. And so in a sense, everybody got vaccinated for something and protected them. And by the time they were vaccinated, that virus wasn't the virus that was attacking them. And in a sense, that means that the vaccine continued to have to be boosted and updated. And that's not a way to actually engage with the immune system. In fact, the immune system doesn't necessarily like being poked all the time. And sometimes if it gets poked all the time, it roars. And so the onset of new autoimmune diseases and other inflammatory syndromes are kind of just out of control. There was a recent meta-analysis that looked at autoimmune diseases in children, and in the vaccinated, and this was about 400,000 kids. In the vaccinated population of children, there was a 0.2% increase in autoimmune diseases. That doesn't sound like many people, but when you think about it, that's about 8,000 kids that have a new autoimmune disease. That doesn't seem like something that we should be doing to children, especially when they had no benefit from it.
It's been proven in court. The EU Parliament had a hearing. Documents have been presented that mandating the human race, mandating the people in Britain to take Pfizer, AstraZeneca, and Moderna was illegal, and the populations are suffering more from the adverse effects. But the questions still linger. Who takes responsibility of these ills in the society? Who takes responsibility of what has happened to the human race? A lot of people are suffering. A lot of people have died. A lot of people are suffering for adverse side effects. Immune systems have been affected. Nowadays, maybe people they're suffering more from colds and flus that were never there. You know, who takes responsibilities of tampering with immune systems? For this and more conversations, please subscribe to my YouTube channel, like, share this video. We are not doing these videos to judge. We are doing these videos to inform and enlighten the people. We are doing these videos to see where we went wrong. What can we do right? You know. So if you took the shots, if you're suffering from an adverse effect, comment below and let's have this conversation. If you're willing to come on, we can have this conversation to help other people, because what we want to do right now is help the community. Stay tuned. We're going to have a part 2 with a medical doctor doing more analysis, and we are going to have a part 3 where we're going to talk to people that have been affected. Thank you so much. Subscribe and like my YouTube channel. Thank you.